Mrs. Graybach. I'm
Hi.
Marina. I'm a nurse practitioner student.
Hi, Maria.
How are you?
Well, all right.
And what brings you here today?
I need a physical.
Okay. And we'll start by you telling me a little bit more about yourself. Let's see, how old are you?
50.
Okay. And what is your occupation?
PCT,
Which is?
patient care tech,
Okay, and where do you work?
Boger Hospital in Circleville.
Do you work full-time or part-time?
Full time.
Okay, and are you married?
Yes.
Good to die. Okay. And who referred you to me?
Dr. Palmer.
Okay. So you need a physical for work?
Yeah.
Okay. Okay, very good. Are you comfortable?
Yes.
Good. Okay, I will ask you some detailed questions so I know more about you and your medical history. That way I can help you better.
Okay.
So, the first question we'll talk about is your present illness history. Like what illnesses, diseases, and conditions you have today.
I have fibromyalgia.
Okay?
I have some varicose, what do you call it?
Veins?
Yeah, varicose veins, spider veins.
Um,
Legs and feet hurt all the time.
you have varicose veins on your legs and feet?
Yes.
Okay. Both legs?
Yes.
Okay. Anything else?
I have acid reflux.
Okay.
That's all I can think of.
So fibromyalgia, varicose veins on both legs and feet, and acid reflux.
Yes.
Okay. Do you take presently any medications?
Yes, I take medication.
Okay, what are they?
Janumet. Oh, I am a diabetic. I forgot to tell you.
All right. Insulin dependent?
Yes.
Okay. So medications, you brought a list, that's very good.
Yes. You want the list?
Sure. Okay. These are all prescribed, right?
Yes.
Genumed.
I forgot the shot.
You what?
The shot. I can't even think
Well,
of what
we'll
it's called.
talk about it in a minute. Genumed 1000.
Lemire.
Klein. I'm just copying these from your list. Okay, so Genumet 50/1000, right?
Mm-hmm.
And then Klein Pteridine,
Mm-hmm.
is that what
It's
it
for
says?
yeah.
4 milligrams. And lisonopiriol something. Is that what it says? Lisinopril.
Lessapro.
Oh, okay, I see. Okay, and then what is this?
That's for the acid reflux. I don't know.
Diazolin
Yeah.
and Cymbalta.
Yeah.
Okay,
The Cymbalta for the fibromyalgia.
right. Okay.
And also, I didn't write on there, I take Levemir.
Okay.
80 units once a day.
Okay. Anything over the counter that you get without a prescription?
Advil,
And how often do you take that?
just as needed.
Would you say daily, a couple times a week?
Let's go daily.
Okay. How many pills? 1 to 2?
Yeah.
Okay. Just once a day?
Yeah.
Okay. Any herbals,
No.
alternative supplements?
No.
Any other complementary therapy?
No.
Vitamins?
No.
Calcium supplements? Any
No.
other supplements? Okay. Okay. Are you allergic to anything?
IV dye.
And what happens if you get that?
I can't breathe.
Can't breathe.
Hives. And of course bees.
Same thing?
Yes.
Okay. Any other food allergies?
No.
Anything?
No.
Okay. And are you a smoker?
Yes.
How many packs a day?
About a half a pack a day.
And how long have you smoked?
For about 35 years.
So since you were 15.
15, 16, yeah.
Okay. And did you smoke more?
Oh yeah,
When?
used to, yeah.
Like averaging how many cigarettes would you say?
About a pack and a half a day.
Pack and a half for most of the 35 years.
Yeah.
When did you decrease?
It's been probably about 12 years ago.
That you went to half a pack?
Yeah.
Okay, last 12 years. Half a pack. Okay. Any use of alcohol?
Occasionally.
Define occasionally.
Maybe once a year.
Okay. And beer,
No. Oh.
wine, like if you have one
Smirnoff Ice.
I see.
Or Coke and Jack.
Oh my gosh. I will have to do a lot of editing. Smirnoff Ice. Pepsi and Jack.
Yeah.
Okay. Moving on. Now we're going to talk about your past medical history. In the past, if you have had any illnesses, any diseases, have been hospitalized for any reason.
Hospitalized for having kids.
Okay, so
Chest pain.
how many times were you hospitalized for having kids?
4.
For vaginal deliveries?
Yes.
Okay. And what years were those?
For the kids?
Uh-huh.
1977, 1979, 1980, and 1984.
Okay. And you said chest pain.
Yeah.
You were hospitalized for that when?
2011.
Oh, so this year.
Yeah.
Okay. And what about childhood illnesses, if you remember? Have you ever had like whooping cough?
3-day measles is all I've ever had.
Okay. Do you remember how old you were then?
Little. Maybe 4 or 5.
Okay. Chicken pox?
No.
Polio?
No.
Nothing
No.
else? Okay.
Nothing else.
Alright. Any other illnesses?
No.
Okay. Let's see, previous surgeries, have you had any type of surgery?
Yes.
Okay. What was your first surgery that you remember?
My foot, my left foot,
Okay, left foot, what year was that?
2000.
And what did they do?
Went in and took an extra bone on my little toe, broke my toe, put pins in my little toe, pins and screws.
Took out extra bone, broke it, and put pins and screws. Okay. What kind of symptoms were you having prior to?
Lots of foot pain.
Okay. Alright, any other surgeries?
Balloon ablation.
And what year?
2002.
Okay, what symptoms were you having prior to having
Bleeding
it
heavily
done?
for 6 months.
I see.
Lots of blood clots. Baseball size.
And the ablation took care of that?
Yep.
Okay. Any other surgeries?
I've had breast biopsy on, first one was on my left breast.
Okay.
And that was in probably, gosh, 2004.
Okay.
And then my right breast, 2005. And then I had 3 molds and a cyst taken off. Had a cyst on my chest and 2 molds on my chest and a mole on my nose. And that was 2010.
Okay.
That
And what symptoms were you having when you had the breast biopsies?
lumps. Found lumps.
Okay. Alright, any other surgeries?
No.
Okay.
No.
Moving on. Alright, any psychiatric history in yourself?
No.
Different illnesses, diagnosis?
No.
Nothing. Okay. Now we will talk about how you maintain your health. We'll talk about immunizations. Do you know if you're current on your immunizations?
As far as I know.
And what have you had recently? What immunizations?
What's the one that we have here?
Hepatitis B?
Yeah.
Okay.
Had the flu.
Okay. Last flu season?
Yeah.
So in 2010, okay. Have you got varicella like the chicken pox or
No.
measles, mumps, rubella? Okay. What about the tuberculin skin test when they?
Yes.
Okay, so in 2000 and,
11.
okay. Pap smear? When was your last one?
2010.
Okay, have you ever had a mammogram?
Yes.
When was that, the last one?
2010.
What about testing your stool for blood in it?
No.
Okay, cholesterol check?
Yes.
When was that?
2010.
Okay, any other screening tests for anything?
Just for diabetes.
Okay. When was that?
2010.
Okay, very good. Alright, moving on to your family, and this would be your parents, grandparents, your children, their kids, so your grandchildren, and your siblings. Starting with your grandparents, if they're alive or not, and if you know of what and what age they passed away.
On both sides, mom and dad.
If you know.
All right, on dad's side, Grandpa was 77.
Okay.
Passed away of heart attack.
Okay.
Dad's side, Grandma. She was 82. Passed away, stroke.
Okay.
And mom's side, Grandpa, emphysema.
Do you remember how old he was?
He was 79,
Okay.
and Grandma on mom's side, she had Alzheimer's, just old age. She passed away from, and she was about 80.
Okay. Now your parents.
Okay, my dad, oh no, okay, he passed away, he was 69, of congestive heart failure and cancer, bladder cancer.
Okay. And your mom.
My mother is living, and she's 70.
Okay. And how many siblings do you have?
My kids.
Your
Brothers.
sisters.
I have 2 brothers.
Okay, how old are they?
Larry's 49 and 46, both living.
And so are you are you the oldest?
Yes.
Okay. Okay. So it's you and then your brother who's 49, your brother who's 46.
Yeah.
Okay. Any other siblings that are not living?
Yes.
Okay.
2 sisters and a brother.
Okay.
One sister was 18 months old when she passed away, pneumonia. And a brother and sister that was stillborn.
Okay. And your kids, you and your husband, who is how old now?
Who?
Your husband.
49.
Okay. And you guys have how many children?
4.
Okay.
No, I had a miscarriage.
Okay.
Be my first one.
Okay. And the oldest is boy, girl.
Girl,
Okay. How old is she?
34.
Okay. And then next is
Son, 31.
okay.
No, I'm sorry, 32.
Okay.
Son, 31. Son, 27.
Okay. Backing up just for a second, your brothers that are 49 and 46, any illnesses in them?
No, they're fine.
Okay. Okay. Do any of your kids have any medical illnesses?
My daughter has diabetes,
Insulin controlled or diet controlled?
pills.
Okay. Alright.
And my 32-year-old has diabetes, and he takes just pills.
Okay, and the last
The other
two
two
are
is
yeah,
fine.
healthy, okay. Very good. Now, since we're discussing the family, we'll backtrack a little. And, your obstetrical and gynecological history. So you were pregnant 5 times, right?
Yes.
And have 4 children. They were term, early, preterm,
Term.
term. Okay. And do you remember how old you were when you started having periods?
13.
Okay. And you had a period every month?
Yeah.
Would you say they were heavy, regular?
Moderate.
Okay. And prior to getting balloon ablation, what type of contraception were you using?
Nothing.
Okay.
Ernie had a vasectomy.
Oh, okay.
I didn't use
What year was that?
When did he have that done?
Uh-huh.
84, I'm sorry, 84. Had it done in 84.
So right after you
Right
had
after
the last
Brian,
job?
yeah.
Okay. I'm going to die now. Okay, how would you describe your current sexual function?
Has cobwebs. I'm sorry.
You know I
None.
you know I will have to edit all this.
Absent.
Okay. And-
Absent because me and my husband is going to get a divorce. Okay. Let me just throw that in there.
Okay. Is this a recent development or not?
About a year.
Okay. We'll talk about that a little bit later in our
Okay.
interview. Okay. Alright, now we'll talk about your personal and your social history. Where and who from do you get support? If you need support for any reason?
My friends,
Okay,
my children.
children, okay. And how would you describe your coping style?
I think I cope pretty well.
Okay. What would you say your strengths are?
In what way?
In personal coping way? Family way?
Pretty strong.
Okay. And any fears?
No.
Okay. And you said you work as a patient care tech.
Mm-hmm.
Any schooling after high school?
Just for my PCT.
That was like a year.
It's like, I don't remember how long it did take.
Okay. That's fine. How would you describe your current home situation?
Stable.
Okay. And so you and your husband have been married for
34 years.
are getting a divorce,
Yes.
and you seem to be coping
Yeah,
you said well
now.
with that? Okay.
Yeah.
Would you say this was a source of stress?
Oh yeah. Big stress. But I learned to work through it.
Other than friends, anybody else helped you get through it?
Just no, my kids.
Family and friends,
Yeah.
okay. Any other important life experiences, such as jobs, financial?
Losing my father.
Okay. That was last year, right?
Yeah. That was worse than getting a divorce. To this day, it's still bad.
Where do you get support for that stress?
Just my brothers, my kids, friends.
Okay. Do you do anything at your leisure for fun?
Yeah, have been.
Such as?
Ghost hunting.
Okay.
Going to haunted places. That's my big thing now.
Okay. You enjoy that?
Oh yeah.
Okay. Any religious or spiritual activities?
I go to church every now and then.
Okay. How would you describe your exercise habits?
Or
How often would you say you exercise?
maybe once a week. I used to
Okay.
walk all the time, but it's too hot. Now's the time to get back into it.
Yes. Okay, so once a week you exercise, and what do you do? Still walk?
Yeah, and we
Okay. And your diet. What does it consist of, and how many meals a day would you eat? And what is your primary?
Well, I've been
Food choices.
trying to eat 3 meals a day
Okay.
since diabetic now.
Okay.
Some choices are good, some choices aren't.
Okay. But can you describe to me like what you ate today
What
for
did I eat
breakfast?
today? I'm bad, I didn't have nothing for breakfast.
Okay. Lunch.
I had a turkey sandwich on wheat bread.
Anything else with it?
Nope,
And any snacks?
nope,
And you haven't had dinner yet?
nope.
Okay. Do you drink coffee?
Yes,
How many cups a day would you say?
4 to 6.
Tea?
Yeah,
How many cups a day would you say?
not cups, glasses.
Okay.
Probably about 3.
Like you drink iced tea?
Yeah.
Okay. And any other caffeinated beverages?
I
Coke.
had a Pepsi today.
Okay. Very good. Moving on. Do you practice safety measures such as wearing a seatbelt when you drive?
Yes,
What percentage of time would you say?
all the time.
Okay, that's very good. Do you wear sunblock in the summer?
Sometimes.
Okay. What percentage of time would you say?
Maybe about 50% of the time.
Okay. Any other safety measures such as home smoke detectors?
Yes.
Okay. Anything else that you practice that safety wise? No?
Mhm.
Okay.